Good afternoon, everyone, and welcome back to Seriously Curious. It's a podcast where we talk about all things human centered for business, strategy, and design. I'm Chris Rockwell, I'm president and founder of Lexton, where we shape future experiences through a deep understanding of humans and their behaviors and their aspirations to help businesses succeed. Today I'm really excited about our topic. We're talking about the future of healthcare and what's happening in healthcare with rapid acceleration of technology, but also increasing complexity for both clinicians and patients. And so we want to talk a little bit about what are the things that are really going to shape the future of healthcare experiences and how we can use human insights to really transform both how we serve them as clinicians and healthcare workers, but also how patients can be empowered. So today I'm super excited to welcome Vanessa Christie. She's Senior Director of User Experience at Insulet, the maker of the Omnipod, which is an insulin delivery system for patients who suffer with type 2 diabetes. And so I'm super excited to have her here. She's been advancing healthcare through UX leadership, and I'm going to have her talk a little bit about her journey. And she's also, I'm pretty excited that she's pursuing a master's in digital healthcare, which I think is amazing. And I want to hear more about that today. So Vanessa, thanks so much for taking time and joining us today.
Yeah, thanks. No, an honor to be here. Thanks so much for the invitation.
Yeah. Tell us a little about yourself and your journey. I mean, how did you arrive here and sort of what motivated you through your professional career?
Yeah, no, I was reflecting on this yesterday. How I arrived. I've been doing this for, I guess it's around 25 years. I was thinking about it just yesterday, and I thought, wow, that number kind of scares me a little bit. But around 25 years of being invested and contributing to any kind of product experience.
Yeah.
I started off focusing in basically agency and then consumer product.
Mhm.
And then went to J&J MedTech, spent a good portion of my career there, really focusing on the surgeons and what needed to take place in the OR. And now doing almost the intersection of, I feel like, my profession that was consumer with at P&G and Gillette to my MedTech profession with surgeons and now focusing on digital health. As you mentioned, for our PWDs, for type 1 and type 2 diabetes, and then also our endocrinologists.
Yeah.
So it's this brilliant intersection now.
Yeah, I'm really interested to hear more about how maybe your consumer understanding is impacting the way that we're treating patients now, which is getting a little bit more consumer-like in some ways. But so let's come back to that. But tell me about this master's in digital health. I mean, why do that and why now?
Yeah. For me, like I've always been like a lifelong learner. As early as I can remember, throughout my career, I've always been taking certifications of something, reading books on something, and then decided that I was at the point where I needed like more, and thinking like, how am I going to contribute, hopefully for the next 15, 20 years of my career? And just thrilled by kind of where we are right now at this, I feel this tipping point of like humanizing technology and bringing in like AI and wearables to transform patient care. And had done some research to understand, like, does that mean I go back to complete my MBA? And then to be honest, I was unaware of the master's in digital health and did some research and, wound up looking at that program and was like, oh my God, this is the perfect intersection of what I've been seeking.
Yeah.
So started pursuing my master's in digital health and hope that, that I, that I can kind of be a forerunner in bringing that forward and making sure that human-centered design isn't lost as we rapidly progress to partnering with our wearables and our robots,
Yeah.
and everything. So it's been a thrilling journey, and yeah, I'm just extremely excited about where it's going.
Yeah, what's unique about the masters in digital health? I mean, how is it sort of focused and how might it be different than say a MBA or say a master's in human centered design or something like that?
Yeah, I mean, at least the program I'm in, I had done like some research on programs. I actually chose Iowa State University because their program to me was so connected to the user and how we're partnering with the user and not removing the user out of kind of this transformation. So, it connected with me on that level. But I would say for me, really looking into how like technology is enabling patient care and physician care was really what sparked to me. So you are doing like, you're looking at policy changes that might have to, be brought forward. You're looking at the integration of AI and wearables and genomics. So for me, it was kind of like really looking at like this holistic user in a different way than I had been trained to do, and really looking at all the systems that I would have to understand in a greater level to still bring that humanness
Yeah.
to that patient care.
Yeah. It's interesting. It seems like over the last at least 20, 25 years, we've been moving in healthcare from more from acute care, sort of more to chronic disease management, and then eventually to prevention and wellness. I think it seems to be the arc. Um, I'm really interested in the work that you're doing in type 2 diabetes management. And specifically, glucose monitoring is becoming more and more available. People are aware of the impacts that chronic disease like diabetes has on their lives. But now you've taken it further with the Omnipod to actually do insulin delivery, which I think is an amazing next step there. Can you tell me just a little bit about the kind of work that you're doing in Insulet?
Yeah. So from a user experience standpoint, the great thing about Insulet is I would say everyone feels like they own user experience. And I think it really goes back to like the culture that Insulet has fostered since day one, which is truly about human-centered design. So in every single meeting, there's never a time where you're not hearing about the user, and that can be brought up by everyone in the room. So I would say definitely looking at kind of how we can make diabetes management easier, more intuitive, allow people to focus on their life over their disease state, really looking at, the cognitive burden that this might put on our users. And our users, when I say that, not just the PWDs, but the parents that care for their children that are diagnosed with diabetes, elderly parents, the HCPs, the clinical staff, looking at the whole ecosystem and making sure that we're doing our best to elevate that whole care delivery model.
Yeah. I think, it goes alongside with this trend that patients are taking more and more responsibility for their care, and which brings up a challenge with adherence or compliance with therapy and medication. And it seems like there's opportunities now with the amount of data that's available to both clinicians and patients, the ability to remote monitor and things like that really gives them a place to sort of collaborate and cooperate in their care, which I think, the work you're doing at Insulet is such a great example of that. And it's, it's also evidenced by the business growth that you're having and everything, which is exciting to see. But it must create some unique challenges too, from an experience standpoint, because you have patients participating in a complex domain of their own care.
Yeah, I mean, I let me take more of a from my prior experience, more of a med tech view on that one. I would say I agree. Right, we definitely are empowering patients to kind of take more, participation in their care. But I think that that's like a really exciting place if done right. Extremely exciting place. I think that that's where it becomes, how are the designers and how are the leaders in the company bringing that forward? How are we not putting too much on that patient? How are we designing like intuitive systems that can go at any level of ability? I think that's kind of where we thrive, and where I'm incredibly excited to continue to participate in that realm, and make sure that we are designing products that are always accessible to the best of our ability for the large population that we serve.
Yeah. Yeah, let's talk about a little more maybe about some of the macro shifts in healthcare. So the one that you reference right there is that patients are getting more involved in their own care, which brings along with it some complexity, right? But also a high degree of empowerment. It also changes like where care happens too, right? We're seeing a lot more where therapies are happening in home. The living room becomes kind of the clinical environment in some cases. Tell me about some of the shifts you're seeing in sort of, healthcare in general, and what does it mean for maybe the future of how we take care of, people and get better.
Yeah, I mean, also just another extremely exciting place to be. So that site of care shift and where that's going, I think is like profound on the impact that I could have. I was just reading an article recently and it was talking about, I might misquote my numbers here, but 80% of our elderly population wants to die at home. and it's something like only 40% have the luxury to do that.
Yeah.
And they were talking about kind of as we progress, and I think I can't remember, it was one surgeon or one doctor that was talking about it. And the empowerment that any kind of wearables or AI or remote managing can bring to those patients. And the challenge was, could we ever get to the place where it's only 10% or less that don't get to have their wish of dying at home?
Right.
And that to me is like so thrilling to think about that, to think about like how I could be, living at home and having all these, wearables and device and doctors on demand as I need. I mean, I think it's like just a thrilling space to be. I'll give you an example. Like even my dad, they're monitoring him for AFib, and he went home with a wearable patch for like 2 weeks and still had coffee with the guys, still sat on his porch and watched the birds. And I'm like, this is the future that I would hope that we would get to. And we're watching it unfold where people can still live their day-to-day life and feel secure that they're being monitored. And we're getting the data we need to do a clinical intervention if we need that.
Yeah. You think about the social determinants of health, and then we have the senior tsunami, right? In much of our work, that one of the big ideas that comes out of our work with older generations is their desire to be independent longer, which includes this ability to stay at home, take care of themselves, or be supported by their caregivers, which are, their family and their community. But so they can live longer, right? If they can stay at home and be more independent. And it sounds like from your work, there's much that we can do in the healthcare space to enable that to happen.
Absolutely.
My guess is that the rate of deceleration in healthcare probably it decelerates faster once they're in a care facility, right? They're out of their context. So,
and especially with that generation, right? Like we look at, like you mentioned, the Gray Tsunami, huge population, but like 50% of it's, I think I just read a recent study that's like 50% of 80-year-olds actually have cell phones, right? Or maybe it was 60% have cell phones. And then anyone that's in their 50s and 60s, it's like 80%, but they're like extremely, like that's the first generation of seniors that are technically embracing technology, right? And where it could go. I think that there's so much innovation that could happen to meet the needs of that generation. When we get those innovators and those designers and those business leaders focusing on like, how do we meet those needs? It's such a large population with such a large disposable income.
Yes.
The level of innovation there is tremendous.
Yeah. And the need for UX specifically, I mean, and I think in general, as patients are taking more responsibility for their care, their healing, sometimes we're sending equipment home with them that is highly complex. It was designed for clinicians, not for patients. And so, you take that to maybe an older generation that's not as comfortable with some technology, and that gets very complicated. And then you start really running up against the adherence and compliance challenge, right? Because they can't be compliant. They want to be compliant, but they don't understand how to interface. It seems like that's a great opportunity for folks like yourself and the team at Insulet.
Yeah. I mean, and I would say even like outside of Insulet, like I 100% agree with you. I think that, all the considerations that we need to be thinking through as a user experience leader or designers to make sure that our systems are easy to use, easy to understand, have nice intervention methods if they're not, right? How easy it is to call for remote help. I think that all that is going in the proper direction. I think it's a huge call to action for any user experience designer to make sure, as you rightly said, we're not designing for the clinician. So when we take those devices that were designed for the clinician and just bring it into someone's house, there's potentially a lot of additional considerations we need to think through just to make it accessible, to make it user-friendly, and to give the clinical care that we're hoping to deliver with them at home. So I agree.
I had a recent experience where a family member had to have a central line put in, and we were delivering meds at home. And it was like, it was us, we're like, okay, well, how do I keep this thing clean and sterile? How do I not like create a problem? I mean, there was a lot. it was a really important thing for us to be able to do, but there was a high degree of complexity to it because we weren't trained,
Absolutely.
clinicians. So I do think that there's big opportunities there. The other space that we're investing a lot in is really understanding learning. How do you get people quickly over learning curves
Yeah.
so that you can get them to a level of proficiency? And there's lots of, turns out, as you know, as a UX designer, there are many things we can do to accelerate learning in the experience, in the first moments of truth, so they can be successful and get to a second moment of truth. Because sometimes if they don't succeed in the first, then that's all you get.
Right.
Especially with high levels of automation, we see that quite a bit.
Yeah.
So we talked a little bit about the generational effects, older generation specifically. What other generational things do you see as important for the future of healthcare? Do we see differences among generations?
Yeah, I mean, I think that it's a great question. I definitely think there's different considerations that we're seeing amongst generations, but I would even see amongst cultural differences, right? Like who is adopting the technology, who isn't adopting technology. I think that we do need to be extremely cognizant of there's not like a technology divide that kind of pulls us further apart. And then we show health inequity by the ones that can adopt to that new way of engaging with precision health or apps or wearables or, biomarkers or whatever it might be. So I definitely think there's different generational considerations that we need to put forward, as we talked about with the older generation, and making sure that, as you mentioned, right, this might be the first time they're stepping into their own clinical care, the first time they're challenging a doctor or feeling having the right to challenge a doctor, right? I think with the younger generation, I have so much hope and promise for that generation that already has like embraced it and feels like their data is their data and their care collaborators, and they bring that forward to their physicians, their surgeons, whatever it might be. I just think that's going to be like profound in that, and I'll call it that, in that care collaboration that I don't know if we had at this level before. And I can even speak for my doctors. Like it truly is a dialogue now on kind of what's appropriate and what aligns to me and my lifestyle, rather than, how I grew up, where if the doctor or surgeon said something, you would just abide. So I definitely see that difference, but I do also see the difference between, different cultures that are embracing technology. You have like, Korea that's, embraces technology incredibly quick. You have California that embraces technology very quickly. So just piecing through also just what we can do to make sure, everyone that wants to embrace the technology can.
Yeah. We talked about how patients are being more empowered to participate in their healing and their ongoing therapy. But they're also empowered in the sort of diagnosis and prognosis too, right? There's so much information out there. Tell me, how does that maybe impact the kind of work that you're doing, or how you think about future of healthcare, where younger generations maybe are going to their doctors with more information?
Yeah, I mean, I think I think it's spectacular when we start talking about like, preemptive kind of interventions before we get into like a clinical need state. I love how there's kind of like all of these independent ways now that you can get diagnosis or additional data that you couldn't get before, that then you can bring forward. Then you can bring forward to your clinician.
Yeah.
I think that like that wealth, even myself, looking into preventive medicine, getting my Aura ring, getting my scale that I can, have my body fat scanned, drinking my herbal drinks, everything possible to kind of understand now what I can prevent before it's too late. I think that's going to be the wave of the future. It's something that I hope to be able to bring my son into at a young age, right? Let's figure out kind of things that we should avoid. Is there any biomarkers that we should be concerned about? I'm thrilled with where that's going.
Yeah. I think when we think about generational innovation, or generational UX, I think it's an important thing for us to understand how, in addition to, the differences in how we might help an older population participate in their care versus a younger population can be different.
Yeah.
And And as you mentioned, the other socioeconomic factors that might impact those kind of things,
Yeah.
it makes it important for us to really understand the who component of UX, right? Who are we designing for, and what is the ecosystem that that care is happening in, and then who are the stakeholders? So we've talked a lot about patients today, but it's changing for clinicians as well. Can you say a little bit more about how the technology and data is changing clinicians' approach to care?
Yeah, I mean, I think it kind of, I believe that where you're going with that question is, like we used to use kind of standard guidelines. And now with the more data we bring forward, right, we can have more customized, personalized care plans.
Hmm.
And the physicians can only respond to kind of what information they have.
Yeah.
So again, I'll use my dad as an example, right? 78-year-old man, heart issues, strokes, all this kind of stuff. But was a builder until he was basically in his late 60s. So did physical activity for his whole entire life for hours a day.
Yeah.
Now, if you looked basically him by general guidelines, you might have a different care plan
Hmm.
for him. But if you ask those questions about what was your lifestyle and how often did you do that, and you think about all the social determinants of health, I think that the personalized care plan is going to be something that will transform the clinician patient relationship
Yeah.
and deliver better care.
Yeah, for sure. Well, and there's some amazing emerging technology, right? That can help us. That in our call last week, we talked a lot about where AI is impacting. It's an eventuality. We know it's going to happen.
Yeah.
Tell me a little bit about how you see AI impacting this whole ecosystem that we've been talking about.
I think it's going to touch everything. My biggest thing is I don't know how quick it's going to transform it. I think that we have some things, it's kind of when you look at the US, there's, we have like obviously our regulations or policies, there's not good interoperability. You look at other countries that have great interoperability, Finland, Denmark, etc. I think that in my life, that there's going to be a radical shift to kind of like take all this disparate pieces of health information and put them together into kind of like a single source of truth, basically, that then will deliver better insights. And
Yeah.
I think that that's only possible through AI because the amount of data that we're going to have, like I said, even for myself, from my smartphone to my watch to my scale,
Mm.
right? It's just like profound. And you know, we as humans can compute a lot of information, but AI allows us to compute it so much faster and to create connections that might be even seamless for that system that for us would be extremely emotionally and mentally taxing.
Yeah.
So I think AI is going to radically transform any place we are right now in healthcare. How quick it's going to happen, I'm very eager, but I do know that there's just
Yeah.
systematic roadblocks that could slow it down.
Yeah. I think about, one of the first principles that we learned about as human-centered designers is that computers are good at sort of following rules and humans are good, arguably, at making judgments, right?
Yeah.
And so AI doesn't change that fundamental construct, right? I mean, we still rely on humans to provide the judgment parts of it, but the AI can see, you mentioned all these data things. One of the things that technology can do is see patterns, right? And connect dots in ways that humans can't
Yep.
because it's happening over time and it's coming from many sources. So there's as you say, a great opportunity for technology to help us identify patterns, give us the feedback so that it can either autonomously adjust things like medicine delivery or care compliance, or help us make better decisions about it. So tell us a little bit about how you see human in the loop when it comes to AI. It's really a with, not for, right?
Yeah, I agree. I mean, I always love the term just like a cobot rather than a robot or
Yeah.
akin to something like that.
Yeah.
Because I do think that, when we think about physicians in any, domain, that we can't challenge their clinical judgment, right? We still need to let them make their clinical decisions appropriately. But I think it's appropriate that to potentially present a thought partner that can bring more of these disparate data inputs
Yeah.
to allow me to think maybe potentially more broad. So I think that's really exciting. I think that there are some times where we could, if we think about shifting and having the system do things more autonomously without that clinical intervention, I think that could be possible when it's like not critical tasks, right? Or not anything that
Yeah.
would have a user implication. So like, note taking, scheduling of appointments, stuff like that, that scares me less. I think that if we think that the system's going to do clinical decision making, that's where I'm like, oh, I don't know how to work through that one yet.
Yeah. Yeah.
But when I think about my surgeons or doctors being empowered with a wealth of information and having a thinking partner that can aggregate data within
Yeah.
microseconds, yeah, it's
Yeah.
amazing.
Yeah, or even things like take radiology and imaging, for example, the ability to find patterns or detect things that humans otherwise couldn't, I
Yeah,
think is super powerful way to use, use of the technology. And you mentioned being able to automate certain low value add time activities, I think is super powerful. So when you think about diagnosis and helping patients get to the right point of care, I think it can be powerful from that standpoint. I think I was at a conference for Ohio, it was Ohio Future Technology Conference last week, and several folks actually said if there's any 3 to 5 minute activity that you are doing, you should think about using AI to replace
love
that. So
that.
you mentioned note taking, for example,
Yeah,
and in healthcare, for me, one of the things that's happened is the more technology we put in clinicians' hands, the back gets turned from the patient, right?
yeah,
So now you're filling out information rather than really, empathetically engaging with the patient about what's happening to them and what it means for their life.
absolutely.
So I think the more we can automate some of those things, we can get the clinicians turned back to the
Yeah,
patient, and that's huge value add, right? Because now we're really getting to what the definition of care is.
absolutely. Yeah, I just actually finished a book. I don't think. Oh, I do have it here. Have you read this Deep Medicine yet?
No, no.
Oh, it's absolutely spectacular. And it basically by Topol, I guess that's how you say his last name. But
Okay.
it really talks about that. And the title, kind of what you were saying, how artificial intelligence can make healthcare human again.
Yeah.
And that's such a powerful line because I was reading another study and it was something like on average, physicians who went into, the space that they went to give care, half of their day is basically in admin notes, appointments. So
Yeah.
50% of their time they're spending with patients, the other 50%, like you said, with their back towards the patient or filling out notes in
Yeah.
some other fashion. And to think about automating this to allow the physician to emotionally connect back with the patient,
Mhm.
it's I agree. I think it could make healthcare human again.
Yeah. Yeah. I was talking with my son. He's getting his doctorate in physical therapy, and he's now in one of his clinical rotations. He's seeing a bunch of patients a day. But one of the things he mentions is he has to stay after work for 2 hours to get all of his notes complete.
Yeah.
And so it's a great use case for AI. And the other thing he mentioned was that
Yeah.
he's hearing that physical therapists and clinicians in general are burning out, after maybe 2 or 3 years of practice because there's
Yeah.
just so much pressure for throughput, right? See more patients, which is, I think, a discouraging thing, and also sort of the amount of information overload and compliance that needs to happen.
Yeah.
So I think it's interesting to think how maybe AI can help clinicians do the things they love, which is to practice and to help
Yeah.
people.
Yeah.
So I totally agree with you. I love that idea of how of making healthcare human again.
Yeah. And I think what you said, I was like, I mean, it's something like 40 to 60% of physicians experience that burnout.
Yeah,
And when you watch their day and you see all the information, all the stuff they're processing, you can totally understand how that happens. And that's where I feel like for user experience designers, it's just so critical that we're in there making sure that like the back end stays in the back end
yeah,
and the digital interfaces or the products they're interacting with are intuitive, seamless, easy to use to not, that would be the worst thing to put more cognitive burden
yeah,
on our healthcare system when it's already feeling that stress.
Yeah, yeah, and I think laddering the work that we do up to the emotional and functional benefits or drivers of the experience,
Yeah.
um, so how do we help care be more empathic or empathetic? How do we help clinicians create more touch points of care where patients really feel like they're not lost in some sea of healthcare system complexity?
Yeah.
I think that's one of the things that's I think happened over the last maybe 20 years is the increasing specialization of clinicians has created that fragmentation has resulted in more burden being put on patients and their say family members to kind of weave information together to figure out like, okay, what does this all mean,
Right.
and what does it mean for the prognosis or successful treatment.
Yeah.
Say more a little bit about that and how as UXers we might address that sort of increasing complexity in the healthcare system.
Yeah. I mean, I think that's something that um, there's so many multiple facets to like that problem, and how we
Mhm.
could contribute to trying to relieve it. I agree with, as the technologies increase, we have to make sure we don't put that burden on, as we talked about, that
Mhm.
physician, that patient.
Mhm.
I've been, at companies where our primary focus is on making transferable mental models, to
Mhm.
not have them
Mhm.
learn new ways, right? To have them use the mental model that they've learned, even from consumer into medtech, right? How are they engaging with that app? What is that prompt like?
Yeah.
I think that's like a major area. I think, as we talked about, truly knowing what needs to be front, so the physician or the patient is seeing it, and what really can be on the back end. And you mentioned before, really knowing your design target or your segmentation, and what aligns to their needs. And I
Mhm.
do think that when we go in and we don't think there's a single solution, but there's multiple levels that we can push or pull based on that user that we're targeting, I think that's where we're going to get successful. I
Yeah.
think that the concern is, if we're not doing our due diligence to understand what that cognitive strain is, and if we don't know the whole ecosystem in which our users are in.
Mhm.
So if we just focus on the physician, but we don't know, like, how are they collaborating with their note taker, how are
Yeah.
they collaborating with their nurse, I
Yeah.
think if we don't think broad enough, we could easily think that we solved the solution, and we might have actually created more burden.
Yeah. 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 So maybe AI can play in that, creating more symbiotic, um, a way to weave together the full picture from the clinical side, the
Yeah.
social determinant side, right, and weave all that together. Because I think sometimes we get hung up on AI as sort of a single kind of technology, and it's really I think more about the attributes that AI gives us. The ability to see patterns over time, the ability to connect disparate sources of data and make meaning out of it,
Yeah.
new knowledge, essentially new knowledge creation. You mentioned mass personalization, right? Because everybody's different
Yeah.
and has different history. So it seems to me that if we think about the attributes of AI and how it can serve in sort of the defragmentation, creating clarity, I think it will, and more humanness to the experience
Yeah.
of healthcare. I think that's what I'm really excited about, because I
Yeah.
think that then gives us the ability to really unlock all of the new technology and all of the data that's available to us without creating this, going past the tipping point where we create information overload and confusion.
Yeah. Or, like you said, like having the information to adjust to my needs in a certain situation,
Yeah, yeah,
right? Or having, my physician or my doctor or my app even tell me what the proper tone of voice is for me to listen and to adhere.
yeah,
Like, that's like spectacular. I was doing
yeah,
a project just recently, actually for my master's. And the computer told me that I wasn't being human enough in my delivery, and that would have challenged compliance. And I'm like, oh my God, like, I love it. The
yeah,
AI is telling me that I'm not being human enough,
yeah,
because I jumped to a solution rather than allowing, the patient to kind of get there on their own. And I was like, this is amazing. And, where do you get that kind of feedback now in your career? Like,
yeah,
it was a beautiful dialogue that I was having.
Yeah.
And at the end, when the AI said, be more human, I was like, wow, that's like, that's profound. That's amazing.
Yeah, yeah. That's very interesting. That now, in that case, the technology is bringing the human to the equation.
Exactly.
Yeah. Well, I think that there's so many opportunities, as you mentioned, to how we might use AI to sort of create more successful future healthcare, especially as we move again from acute care to chronic care, which is much more in the hands of the patients. They need to be more responsible. And then eventually to wellness, or prevention. As you mentioned, the amount of information that young people, for example, are using to take more charge over what keeps them healthy longer
Absolutely.
and avoid, the need for chronic care management and the like. So,
Yeah. No, I think that it's such an interesting one because even now we go back down to like, my caveman brain of even though I have all this information, like I know I should be getting up, I don't know, every 10 minutes, 15 minutes with my ring.
yeah,
Am I doing that? And so I'm not doing it. So even though I have the information and the technology is nudging me for better health, I still haven't created this. I don't know if it's like a symbiotic relationship with it that I abide by it,
yeah,
by its suggestions. So
mm,
I think that that's going to be really interesting in terms of like when we go asynchronous, do I have less accountability? Because if that was my doctor calling me, right, I would be like, okay, I got to get up, right? And I
yeah,
would go up and go walk. But when my app goes off, I'm like, okay, cool, 15 more minutes, right? So I don't have that same accountability or responsibility. And
mm,
that's where I think it's going to be really interesting. I don't know yet what that tipping point is with asynchronous communication, monitoring, whatever we want to call it,
mm,
where clinical care decreases because accountability decreased.
yeah,
That's
yeah.
interesting.
Yeah, kind of back to that adherence and compliance thing. That's still fundamentally in the hands of humans, right?
Yeah.
So how do you motivate them? How do you create habit forming type of activities, right? So
Yeah.
that there's a lot that we know about how many times you have to do something before it becomes a habit, before you start to before there's like cognitive dissonance. Like if I don't do it, I'm feeling that it's not normal. Right now, staying sedentary and not getting up, or
Right.
grabbing the snack feels normal. We have to flip
Yeah.
that, right? And that's
Yeah.
about human perception and cognition and how we can begin to change behavior. So
Right.
that's really interesting because in some cases, AI, like you say, AI can help us understand and can help us, tell us what we need to do, but can't always do it for us.
Yeah. Or create that like, that like if my mom was calling me right now and was screaming at me, I would get up and I would do my walk.
Yeah, yeah, right,
Right.
right.
But yet, I don't have that same emotional connection, that same accountability when it's AI.
Mhm.
Do I trust it? Yeah, I totally trust it. Like I trust it
Yeah,
in means that I should get up and walk.
yeah,
But yeah, I feel like that's going to be really interesting as we progress because now I know what I should be changing, but I'm not changing it.
right, right. Well, the fact that that data maybe is part of your relationship with your caregivers or your healthcare provider now could
Yeah,
be additional motivation, right? So when
yeah,
they ask you how many
that's
times
true.
a week you exercise, you can't fib. You
Right?
have to
That's
actually
true.
tell them, because you can't get around it anymore. Or I love the one like, well, how many drinks do you have a week? And
Yeah.
you're like
Water? I don't know what you're asking.
right, right. So I suppose the information can help us find motivation
Yeah,
um, for adherence and for compliance, so we can really begin to move the needle on
yeah.
health.
I
So,
hope so. I
yeah,
hope so.
yeah, and of course, the world is also moving towards agentic AI, right? Where
Mm.
the AIs is actually making some decisions for us, right? And so it'll be interesting to see as healthcare moves forward, like where is the right tipping point for agentic AI? I
Absolutely.
think about in some ways Omnipod is kind of an agentic solution, right? In that it's keeping track of your glucose, and it's building you a personalized way to put, to uh, help you comply with your medication, the insulin, right,
Absolutely.
when you need it. Yeah,
Yeah.
because it's something you can't see, right? Humans aren't good at knowing, hey, my blood sugar is high or low right now. I guess they learn to do it over time,
Yeah.
but this technology can really help us come into more compliance and adherence, which would lead to much better outcomes and better life.
Absolutely, yeah.
So,
Or like to build on what you're saying, I was reading something just recently, and he was talking about speech recognition, and it
mm,
was talking about like having this very passive kind of like listening that could be happening, right? That would be telling me if I was having a stroke, or do I sound fatigued enough, or did I take my medicine based on
yep,
like my speech, and all of that. I love when we think that there's this passive kind of like you know supportive partner behind us that might be triggering things that I might not even know, right? That I might not even be realizing that my speech is slower,
yep,
right? That like, wow, I guess I do sound fatigued. Oh
hmm
wow, that might not be good. Why is that happening, so I love that we could basically be bringing this wealth of data and even flagging things that even though I've been in this body for how long, I
yeah,
might not be consciously registering.
yeah.
Yeah, exciting space.
Yeah, we see that in the safety impacts from things like that, like in mobility, how your vehicle technology can see if you're getting drowsy or if
Yeah,
you're nodding off. It can get way ahead of where fatigue is happening or where you're not paying attention. And so
absolutely.
I think that's an important part of keeping us safe. I'll tell you an interesting story. This interesting human factor story. Um, my dad, when I was very young, he taught at Ohio State University, and he would drive into work and he would dictate his notes on the way to work,
Yeah.
basically. And then his admin would transcribe the notes, right? And she would see him about halfway through the day, and she'd go, "Man, traffic must have been really bad this morning." And he's like, "How do you know?" Because his speech would become halted because the
Oh,
in higher levels of workload because of higher traffic
yeah.
meant that his utterances were more uneven. And so it's a great example of how technology now could detect that same kind of thing and go,
Yeah.
hey, maybe let's not do this right now because traffic is intense.
Right.
Let's do this complex activity later. And I
Yeah.
think for healthcare it can be the same kind of thing, like, right, or when you think about the context of care, like you mentioned, um, maybe your ring tells you it's time to get up and move around, but your calendar knows you're in an important meeting with the board. It's like, now
Yeah.
is not the time to be telling me to get up and move around.
Yeah.
So can we get smarter from a UX standpoint and create
Absolutely.
experiences that really fundamentally serve people, like
Yeah,
you
what you
said?
were just talking about, it brought up something that I was reading the other day, and it was talking about looking at lung scans. And this physician was partnering with potentially like a new AI that might emerge. And what it was doing is it was taking the critical cases and basically saying, we're going to put that in the morning for you to review. And at the end of the day, we've pre looked through these lung
Mhm.
imagings. These look to be the ones that are low risk. We're going to give you that at the end of the day.
Yeah,
And I was like, that's a brilliant example of where AI would deliver elevated patient care,
yeah,
right? So I thought that was a great example.
amazing. Yeah,
Yeah.
yeah. Vanessa, this has been amazing. I hope you've enjoyed. I've enjoyed our conversation. Is there anything else that we haven't talked about today that you kind of wanted to address?
No, I mean, I think that you covered like so much. Thank you so much for the honor to kind of like be on
Yeah,
this. I
yeah,
hope, everyone is inspired about where we're going, and feel that call to action.
yeah.
It's really an exciting place and fortunate to be here in this time and place to engage at this level.
Yeah. Amazing work that you're doing, and leadership within your organization. And I think it's a good lesson for all of us to think about too, like, hey, where can I continue to be learning? I think it's I love the fact that you've gone back to school, because we always need to be learning. I think the day you stop learning is the day you die, kind of thing.
Yeah, no, absolutely.
But so maybe just to wrap up, what's one thing that you're really curious about right now that you're trying to learn about and you're trying to get better at?
Yeah.
Uh, what are you seriously curious about right now?
Yeah. Oh, God, there's so much. I would say, definitely as kind of we lightly chatted about, really curious to kind of go into asynchronous, communication or monitoring and see where that
Mm.
tipping point is, like we talked about, where clinical care decreases or engagement or accountability decreases. Excited about that. I would say an area that I didn't think that I would have to dive into, that as I progress in my career, I'm realizing, oh, I do got to get better on that, is like policy making.
Okay.
And what policies, what regulations,
Mm.
what are the challenges with interoperability, how that could be affecting what we think is a brilliant solution. So I would say for me, it's really just kind of becoming more mindful of that, total ecosystem.
Yeah.
So policy is definitely one that I'm intrigued by. How are we creating new CPT codes? What is that process? You know, yeah, I just want to make sure that the technologies that we're bringing forward can actually launch into the real world. So
Yeah.
that's an exciting area.
Do you feel like, as a practitioner, you have an opportunity to influence that policy making, or do you feel like you're a recipient of it and you need to sort of react in your work to how you're going to make things compliant?
I think that from my experience, it's really working in companies that's ethos is about like
Mm.
mobilizing transformation.
Okay.
When I've been in companies and in a company that like focuses on that,
Mhm.
I learned so much from my colleagues that are much better at kind of like knowing the system and working within the system. So
Okay.
I would say like I hope to be acting as a contributor to it.
Yeah.
But there's definitely other people that, just are much more, have a better grounding in it and can do it much better than I. But I
Yeah.
hope to be a contributor and continue to learn to contribute at a higher level. But I would say it comes down to the company culture
Yeah.
and ethos.
Yeah. And of course, part of our job too is this sort of like FDA compliance activity itself, a human centered process, right? How do we understand failure modes and effects analysis? How do we gather data to show efficacy?
Yeah.
And that's going to continue to be an important part of a skill set we need to have to be able to, to get and be compliant with whatever is happening
Yeah.
at the decision making level, but also then to be hopefully influence it as well.
Absolutely.
Yeah,
And that's
yeah.
where I feel like, I feel like it's changed. I don't know when I think it's changed. I don't know if it's 15, 20 years ago where I feel like, designers realized their job wasn't just designing for their user. It was understanding the business and being able
Mm,
to connect the user need to that business outcome. And I feel really hopeful that I see that much more now than ever,
yeah,
right? That the designers know how to have the business hat and also the user experience hat. And the blending of those two, I think, is critical for our
yeah.
contribution in agency or organization.
Yeah. Boy, you are spot on there. Anybody that I talk to in our space is, I'm really emphasizing this idea of business sensitivity.
Yeah,
Like, how do you connect the work you do to business KPIs?
absolutely.
Because if you're not doing that, then you run the risk of getting caught like everything else. And not only that, but I mean, we should be advocating for the work that we're doing and demonstrating how it's connecting to business results, not only creating great experiences for customer, not only solving problems
Right.
for our B2B partners and our other stakeholders, but
Yeah.
really truly impacting results, because it does.
Oh my God. Yes.
Yeah, and I agree with you. I think it's one of the most important things. People who follow Seriously Curious know I talk about that almost every podcast.
Yeah.
Like get more sensitive and aware of what the business is trying to decide, and
Yeah.
how the work that we're doing can inform that. Yeah,
Absolutely. Yeah, I think that is the key element to have a design team that's functioning as like a strategic enabler for change.
yeah,
And to do that, you have to, be able to speak the language or know where the business is going or know their strategic imperatives, whatever that might be.
yeah,
But yes, I agree. I see that happening much more often, and I think it's really promising the voice and the advocacy I see now that user experience has, that
yeah.
isn't just execution. It
Mhm.
is strategic and it is seen as a business imperative.
That's great. Yeah, it's good to see that. I think that the message is getting out there and that the teams are getting more sophisticated when it comes to how our work is impacting business results.
Yeah.
It's interesting. Um, you know, 10 years ago, this new position got created called the Chief Experience Officer.
Mm,
So many of these businesses like put in these Chief Experience Officers. But
yeah.
then, like 8 years later, those positions started going away. And it was a little alarming. I'm like, okay, what does this mean? Like, did
Mm,
we not convert? Did we worked hard to get a seat at the
yeah.
table, and then and then what happened? So I think part of it is for us to continue to advocate for that, the importance of that role, but that it's not owned by an individual. I think that's part of the disconnect. It's like, no, experience is not owned by one individual. It's a cultural thing, as you say,
Right.
a culture that's dedicated to delivering better results. And then part of our job is to empower the organization with the insights and the capabilities to deliver better and better experiences
Yeah.
for business impact.
Absolutely.
But yeah, so that was a little bit of a disconcerting thing that I began to see, like, wait a minute, where are all these roles going?
Yeah.
And why are they going away?
It's true. I do have hope though. Like I do have hope there.
Oh,
Like I do have hope that I think now the user experience, is still becoming more critical for differentiation, and
mhm.
it's understood as like a key, input for penetration and adoption.
Yep.
I think that
Yeah.
holistically, any businesses
Yeah.
have a good understanding as it being that strategic enabler to convert, to retain, right? All that
Yeah.
kind of stuff.
Yeah.
So I think we're getting closer. I hope that we see a resurgence of it. But I think that even though we lost some of those roles, our voice didn't diminish,
Yeah.
which
Yeah.
that gives me,
Yeah.
extreme hope.
I don't think it's become any less important. In fact, when I first started Lexington, there was a lot of like, hey, this experience stuff matters, and they're like, really? Like I would have people say, like, they pay you to do that? And I'll be like, yeah, no, they actually do,
Yeah,
but now we don't have to do that.
right.
Big businesses, industrial conglomerates understand that experience matters and
Yeah,
that it's competitively differentiating. So I don't think that's become any less important, to your point.
yeah,
I think it's a matter of how does our role evolve
yeah,
and to become more strategic to the organization. It's not just a tactical, pushing pixels around. This is like
right.
a strategic imperative for the business. And how do we empower how do we align and empower the
Yeah,
organization? So
absolutely.
I'm so glad you brought that up because I think it's super critical
And I
for
think
our
what you brought
future.
up was perfect because you talked about like the business KPIs 100%. And then how are we measuring if we're
Yeah.
successful? Like,
Right.
what is our baseline before we engage?
Mhm.
How much did we elevate that baseline?
Right.
I think that's like, the critical thing. Once we can get to basically what was the baseline, how much did user experience, even
Yeah.
independently, move that moat? I
Yeah.
think that we have, a really strong case study to kind of push and
Yeah.
dimensionalize the value. And I
Yeah.
think now with all the new technologies coming out, we do have ways to measure it differently than we did before.
For sure. Yeah. I think moving beyond, things like customer satisfaction or net promoter score or, the things that impact us, in the healthcare space.
Yeah.
Um, Press Ganey is what I was thinking of. Like, like those are all great, but they're not necessarily diagnostic
Yeah.
of where in the experience we need to improve. And they're not necessarily predictive of how the business will compete and differentiate. So we
Absolutely.
need better metrics from that standpoint and things that connect to the value drivers that are really impacting our stakeholders, our clinicians, our patients, or our internal stakeholders.
Yeah.
We've talked a lot today about trust
Oh,
or confidence, with a product. It's like, how do we define that? How do we deliver it? And then how do we measure it to see how well we did with that and then connect that to the stock price? It's like, so like, did we, are we demonstrating how our work is differentiating and moving the needle?
yeah. Or like you said, containing users in the ecosystem,
Mhm.
right? Like, I mean, how are we doing that? But you mentioned, give me kind of like a motion capture study any day, layered with eye tracking, layered with all the new methods
Yeah.
that we can use to basically show that we did move the needle and that
Yeah.
it mattered,
Yeah.
and that it had some kind of benefit to the user, to the business, to that strategic imperative.
Yeah.
That's amazing. That's an amazing
Yeah.
list.
Yeah. Vanessa, this has been amazing. I'm so
Thank you so much.
grateful and thankful that you were able to take some time to do this. I know you're super slammed, so
Thank
thanks.
you so much. It was an honor.
Appreciate it. Yeah. Any anywhere where folks can get a hold of you if they want to learn a little bit more, LinkedIn, or what's the best way to get in
Yeah,
touch
sure.
with
I
you?
mean, LinkedIn is always a great way. I might not respond as quick as I would like, but
Yeah.
always happy to like connect with people on LinkedIn. If people are in Boston or if I'm traveling, always happy to get
Okay.
together for a coffee or a drink, whatever it might be. I
That sounds
truly
good.
think that, having a community of thought thinkers that are
Yeah.
pushing in the same direction is critical for the mission ahead.
Yeah. We should get on a conference stage and talk about some of this stuff. So
Yeah, I would love that.
let's find an opportunity to do that.
I would love that.
Okay.
Thank you so
Thanks
much.
again. So thanks, Vanessa, so much for being here today.
Honor. Thank you.
Yeah. And thank everybody for joining us on Seriously Curious, a podcast human centered for all things business strategy and design. I'm really glad that you're here today, and we're so fortunate to have Vanessa with us today. Stay tuned for future episodes. We're going to look at the future of retail. We're going to be looking at the future of smart mobility, and so many great opportunities for us to understand how we can transform human experience with some of the advanced technologies and with our capability centers in humans. So I'm super excited about that. So stay tuned, and we'll see you next time on Seriously Curious.